You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, why don't you go ahead and introduce today's guest?
Hi, I'm Ivan Zach, and I'm happy to introduce Kevin Maher. I hope I didn't butcher that. We tried before the recording. So we're going to talk about wearables. Kevin is the founder and the president of VetMeasure. He also is a founder of Global VetLink, which he exited from the business in 2017. Congratulations. He holds a Bachelor of Science in Animal Science from Iowa State University. He grew up on the dairy farm and beef cattle operation in central Iowa. And the fun fact, he started snow skiing just after college and have been a fan of the Rocky Mountains and downhill skiing since. Kevin, welcome to the show. Thank you for coming over. This is a topic we never covered here, so I'm really excited to start this.
Thank you very much. I'm really pleased to be here.
So can you tell us a little bit about VetMeasure? I've seen quite a few wearables. We had a couple initiatives when I ran SmartFlow where we wanted to connect wearables to it. And there was some technical limitations. So I'm excited to learn about what do you have, how does that work, and how does it fit into veterinary workflow?
Yes, I'd love to explain that to you. VetMeasure, the concept with our wearable device was that there's a disconnect between veterinary practices and their clients, and more so between the veterinarian and staff and patients that are in a hospital. So our focus has been engaging technology, the veterinarian with technology in the practice setting in a more affordable way with our wearable device, which is a harness. We started with a collar, and we are measuring temperature, heart rate, respiratory activity, ambient conditions such as temperature and humidity for heat stress warnings. And we found that the collar configuration just wasn't giving us the consistency, reliability that we could get when we started experimenting with a harness around the thoracic cavity. So that's essentially what our device and technology is: wearable, affordable, non-invasive, continuous monitoring device.
Excellent. So between the collar and the harness, so I've seen quite a few products. What were the actual challenges? It was not accurate, or was it not? Because collar to me looks more convenient. If you ask, the pet owner, or just throw it on. Then the harness is probably a little bit more to apply. So what were the technical challenges in between the two?
Well, the collars will. For the metrics that we're measuring, the key metrics, again, temperature, heart rate, respiratory rate. You can get noise to the trachea in a collar setting, configuration, I should say. You can also get temperature of the skin coat. We found that the research studies with axillary temperature measurement, which is essentially the armpits of the dog. We have sensors, 4 sensors on both sides, and we are taking the best reading of those 4 sensors on each side of the animal in the axillary region. And we published a report. The study was conducted at Colorado State University, and we found in the results of the report that were published shows that the temperature settings within 1 degree of Fahrenheit of the rectal temperatures, which is the best study in terms of comparison from between rectal and axillary yet. And that was published last year at a veterinary conference in Washington, D.C.
That's interesting. So it is calibrated to be 1 degree, sort of bumping it up for the user to kind of have a comparison, or you just account for that as the user that that it's going to be 1 degree lower.
We have an algorithm that actually corrects that, so they will get what's close to the most accurate as possible.
Okay, excellent. Shawn?
Kevin, how did you get here? We've got both of your companies, a little bit of previous experience, but how did you arrive to build a wearable for animals? Obviously, you have your background, but what was the catalyst?
Well, on the wearable market, what I did was after building Global VetLink from beginning in 2001, that's a SaaS business. It's still going and growing today. Regulatory compliance, online management for veterinary practices around the country, and now expanding to multiple countries. I just like to innovate and create new ideas and bring them to veterinary medicine. So I started talking to various contacts at veterinary colleges around the country about what technologies have you researched, which ones have potential, which ones are unrealized in terms of their market potential that have shown good research data results. And so I came across the collar device at Colorado State University College of Veterinary Medicine, and I started thinking about that. That has a place in companion animal medicine. It has a place in foals, dairy calves, livestock operations and various types of uses. So I started thinking about where that technology could start with a very large number of canine in households around the country and the expansion of veterinary practices focusing on canine medicine. I felt this is a good fit, and therefore I started going after it and licensed the technology from CSU and brought an engineering team on board, and that's kind of where we started.
Wow, that's excellent. So from the practical point of view, you mentioned that it's a better connection of the pet owner with the veterinarian and the information about the pet. Is that something that the pet would wear every day? Is this sort of like an everyday item you use, or is it something that the veterinarian would send home with, knowing the condition, and they need to kind of get a sample of data to understand the progress?
We're focusing on initially in the veterinary practice setting rather than going directly to the pet owner initially. So the veterinary practice technicians, all its staff at a practice is familiar with the technology. We have a quick start guide, which allows them to put the device on, get it connected to Wi-Fi, and download the mobile app. We have a web app as well. So we try to make it very easy for the vet practice to implement because they're very busy, and to be able to take manual heart rate and manual temperatures and respiratory rate. We're trying to improve the efficiency in a practice and set the highs and lows. The veterinarian can set the highs and lows for each patient per case. And so therefore, they're notified electronically in real time if they go out of that range. So it's really focused on the vet practice first. And secondly, we'll start moving to that transition to maybe the first few days after surgery for at-home monitoring.
Excellent. So I don't know if you thought about this, but I try not to do this at the show to kind of suggest, where the products could go. But it was a real passion of mine. I don't know if you saw SmartFlow, the product that I created for hospitals. It was a treatment sheet, and then further there was an anesthetic sheet that read where you could record your vitals during the surgery.
Yes.
So basically, one direction that we were taking with this, and actually I was experimenting with some wearables, and the accuracy was a problem. But one of the directions that where I was trying to take it is that utilize it. It was very niche in a post-operative environment, because that's the most anesthetic deaths that happen, because people just throw animals in the cage and they recover with normal vitals and then they die. So I thought there was a huge opportunity for wearables in the vet hospitals, actually post-operatively. So you can actually, instead of continuously try to check the patient, where it's centrally connected to, I wanted to connect it to SmartFlow because we ran anesthetic sheet on it and integrate. Maybe IDEX would like to do it because they have it now and my team works for them. But that was one of the initiatives. I don't know if you thought about that particular application, but I think there's a huge need from actual client and patient perspective, post-operative time.
Yes, we really leave it up to the veterinary practice to make that call. We do find that the majority of veterinarians have interest in that stage, post-operative monitoring of the animals. Yes, that is very critical, and there's issues with hypothermia, et cetera. So we are able to monitor those patients really in the setting that the veterinary practice prefers. So if it's post-operative, we're set up to do that. If it's earlier, then that can occur as well. But I totally agree that that's an area that has been shown the greatest need.
Interesting, Kevin. So a question for you. So what do you do for the veterinary practice owner to allow them to drive revenue, or is it more to drive innovation? Are your products Are they helping them add to the bottom line revenue of the practice? Is it a feature offering that can help them grow their revenue? Or what does that look like?
Yes, we studied that within the available data in terms of cost for technician time, cost per veterinarian for various procedures within a hospital. How can we reduce and improve the throughput per patient, within a practice setting? How can we automate and really bring value to the veterinary practice through our automation? That's one savings area, is labor and efficiency, and of course the animal care and the well-being of that patient and the success of that patient's recovery is, of course, the utmost importance. For the overall revenue down the road, we feel that we're focusing on that practice efficiency, first of all, and the attributes I just mentioned. And then we'll move to the next phase, which we anticipate would be about 6 months to a year down the road after implementation within a practice, where they could feel comfortable with select patients to have the device on the animal at discharge and inform the owner at discharge that how the harness works, give them a quick start guide, make sure they've downloaded the app and they've got it connected, and let them know that this is included with the cost of surgery for the first 3 days, for example. And then we'll be charging X number of dollars per day after that, and a consultation fee for any alerts that pop up and any issues that occur. And then after that period, it can be rented and then purchased. So that's kind of our flow that we have in mind at the moment.
Yeah, that's really interesting, and I was hoping you were going to say that. It's kind of like almost a white glove experience. I like how you include it for 3 days. You kind of give them the info, and my next question is paint what that experience looks like, even if it's a future state experience. Like, so the pet owner, I'm guessing, might have an app. The harness is going to be on the animal. The vet is going to see this data as well. But let's dive into that a little bit deeper. Paint the picture for the listeners, because it's really cool.
Yes, since the veterinarian would be the originator of the account and assign that harness to a patient, they would be able to allow, if they have a choice to allow visibility of the data for that client to see that patient's data. They would be able to set the highs and lows for each parameter. If the temperature goes above a certain level or below a certain level, they can watch both cases of hypothermia and hyperthermia. They would be able to actually watch the activity if maybe it's a case where the surgery requires the animal to be not out running around, but more having more of a controlled exercise environment, and that would be measured as well. So the option would be, in answer to your question, would really be up to the veterinarian to say that we're going to allow you access to the data as well. We'll have access to the data, and the alerts that we've preset will notify you if we feel that your patient, that animal we need to change the treatment. We need to change the level of exercise is gone beyond what we recommend. Whatever it might be, respiratory rate is gone too high. So they want to either have the patient come back in, or they'll say that we'll change medication and we'll continue to monitor.
So right now, we always touch on on sort of aspects that are thriving, and one of them is consolidation. So a lot of products that go to market, they really think about the individual practice, but when they grow to a certain size and when the consolidators see that they either have the savings on efficiency, they can increase the throughput, or they can, or they satisfy their clinical needs, but there's a demand from the clinics. They usually start asking questions on the enterprise application of this, of a new particular technology. I don't know if you were contacted by any of the consolidators, or if you thought about your product and how it could be pitched, if you will, to a consolidator. How could they use that in the sort of multiple clinic setting? If there were any thoughts on that.
The main area that we feel with, and we have that process in the early stages right now, so don't have a clear answer for you yet. But the standardized method of post-surgical monitoring, for example, within a practice that's associated with a large network. So you start out and you've got a standardized method, and you have your measurements that are standardized. And by patient, over time, the big data aspect is going to be quite valuable to that network of veterinary practices, as they can learn within their own realm how a certain breed, gender, age, condition, and the treatment that occurred, a surgical treatment or whatever, or maybe be a medical treatment for that animal, what were the results, treatment A versus B, C. So over time, they'll be able to manage that throughout their entire network of practices with more real-time knowledge and with a standardized method of bringing that data to a meaningful state.
Yeah, that makes a lot of sense. It's really interesting. One of the things, Kevin, that you said that I've heard you say it a couple of times, is that it's really up to the veterinarian practice to determine how the device is going to be used or in what fashion it will be used. And my learning, limited learning, and I'd be interested to get Ivan's opinion on this, being in the vet space, is that veterinarians are often looking for a prescription themselves. Here's a device. This is how you use it. This is how you drive revenue for your practice. And I think your ideas are really great, but I think it may make sense to be more prescriptive to some degree. Now, a bunch of veterinarians are gonna hate on me, but it's okay. Ivan, do you agree or disagree?
Well, I mean, it's not about. I'm going to add the hate towards me, because some vets, there's certain ways they're used to do things, and then changing their behaviors is really hard, especially with the new products. So if you are not prescriptive, it's sometimes hard to get their attention, or B, to actually get them to innovate with you. So if you come up with the exact way how to apply this, the workflows, how it fits into your day, your revenue model, then you have a better success. Unless you're a telemedicine and it's a COVID quarantine right now, then everybody gets telemedicine quickly.
And I think it's really important to note for the listeners that I think this is the first time you've ever agreed with me, Ivan, ever in my life since I've known you. So thanks.
I didn't agree with you. I said I'll say more.
Yeah, Kevin, I'd be interested to hear what you think about that.
Oh, I think overall that's the direction that it needs to go. I don't. I feel it's within a practice that if it is prescriptive, and this is the way that we manage all patients from this point forward, we've got. By the way, we have small, medium, and large size harnesses, so they would need to measure the girth of the animal around the thoracic cavity to confirm that it's a small, medium, or large size harness that fits this patient. So then they go through the quick start guide, and the prescriptive nature that you're referring to would be the starting point. Every patient, if it's post-surgical, that's the protocol within this group of practices. But then if they are from post-surgical to discharge, they're monitored 24/7 with Measure On, our wearable harness, and they're presetting the limits, the highs and lows. That would be a very good, consistent way for them to communicate to their patients, to their clients, I should say, that we are doing the very best job possible than what was available before, because we have an affordable way for us to have non-invasive continuous monitoring of each patient from post-surgical to discharge.
Yeah, this is super exciting, Kevin. The technology is really cool. We're out of time. Like it goes so quick. Every one of these episodes is always the same. It seems like nowadays. So just a couple of things to add. If people want to get a hold of you and are interested in trying your products, how do they do that?
Yeah, they can go to our website. Just our website is vetmeasure.com, vetmeasure.com. And the other option would be we have a chat button on our website to ask questions. They can send an email directly to info@vetmeasure.com. and just address a question to us. And as well as they have our phone numbers on the website too.
So I apologize in advance if you get bombarded with inquiries, because I think the technology is really cool.
Well, thank you so much.
We're excited. So the way that we always like to end the show, we got a couple questions. So a book, a TED Talk, something that you'd recommend to our listeners that has been inspirational, inspiring, or other to you?
Well, this is maybe a little different in the veterinary space, but I've just recently read The Gifts of Imperfection by Brené Brown. And it's really a neat, inspiring book, and explains how to cultivate courage and compassion and connection to embrace your imperfections. So I think it's really it's a great way from an even business standpoint of how personally the leader of that group as well as employees can advance.
Sounds like a book that both me and Ivan need to read.
No, Shawn, you're perfect for a Canadian.
So the last question we like to ask is, we're always looking for other innovators in this space. Do you have anybody that you can recommend that we should touch base with?
There's someone we met at the Veterinary Innovation Summit that was held at Colorado State University last year. And I would highly recommend a very innovative man. His name is Richard Ward, and his company is Independent Veterinary Network, based in Kansas City.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.